Remember when science fiction promised a future where technology could heal disease and expand the human potential? Well, that future may be closer than you think. Today, we're joined by Dr. Ann Liebert, Dr. Brian Bicknell, and Scott Faulkner to discuss photobiomodulation therapy using red and infrared light to stimulate healing, fight diseases, improve brain health, and maybe even help humans thrive in space. Now let's get into it. Welcome to Mid-Maryland Votes. I'm your host, Mark Flynn. With me is my co-host,
Ethan Lowen.
And we have some very distinguished guests today. Ethan, could you let us know what the topic is and our guests?
Absolutely. Well, are you familiar with how in Star Trek, there were those medical devices where they just seemed to use scanners and those sensors and those lights, and it could heal anything that ailed any of the crew?
I am a Trekkie from way back. So yes, the answer is yes.
Absolutely. Well, keeping with science fiction and real life meets science fiction, we have two researchers who have come from halfway across the world in Australia to our local community to continue their research in what is called photobiomodulation.
Hold on. Are you saying that we actually have Bones McCoy and Beverly Crusher on the program today?
I will let our viewers make that decision. But as we go through, I think that they're going to give us some very interesting information here.
Awesome. Good stuff.
So I'll take a moment to introduce our first guest here, which is Dr. Ann Liebert, who is a coordinator of research and a practicing clinician at Sydney Adventist Hospital in Australia. Dr. Liebert also has been treating patients for the last 30 years with what we're talking about this evening, photobiomodulation, is a researcher at Sydney University. Also, interestingly, you are a professor at one of the oldest universities in the world, Montpellier in France, at over 800 years.
That's exactly right, and very honoured to be in the medical department there, and also at Shepherd University here in America, which is amazing.
And we are certainly going to get into more detail about what you're seeing here that is so impressive in our local community that is advancing this research. Something else of note is that in 2022, you received the Rosalind Franklin Award, which is something that is a very high prestige. And it is in relation to photobiomodulation. Is that correct?
That's right. It was awarded for my treatment for Parkinson's disease on the microbiome and the abdomen to help stabilize Parkinson's disease. And it was the first one that was ever done for that particular condition. And that's why I was nominated and received that award.
Absolutely. And we also have your research partner, Dr. Brian Bicknell. Am I pronouncing your name properly?
It's close enough.
Now, you are a researcher at the Brain and Mind Center of Sydney University as well. Your research focuses a little bit more specifically, if I understand, on what Dr. Liebner just mentioned, the microbiome and how it affects diseases. Now, the things that we are talking about that you guys are finding, if the right word is cures or massive progress for, are things such as autism, concussions, long COVID, Parkinson's disease, pain management, and the list goes on. Am I kind of touching the tip of the iceberg here?
Yeah, definitely. We mostly focused in Parkinson's disease in our research, but yeah, certainly in Ann's clinic, she treats all of those, all of the above.
Mm-hmm. And you have been doing this for 30 years. So this is not something that has just occurred. This is something that is has quite a track record behind it at this point.
That's right. And interestingly, I did start it in the late 80s after the work with NASA on the space station where they were using light to heal wounds that can't be healed in space where there's no gravity. And so my first laser for musculoskeletal conditions and wounds was a space laser, which I think is very topical presently.
Yes, and I did not know that. So, Mark, when you asked, or do we
I'm
have the
telling you.
real Dr. Bones and the real Crusher? Dr.
Beverly, Brian, that makes you Bones. Sorry. And it's Beverly Crusher.
Now we also
Hold on. That's fascinating, though. The wounds in space and studying that must have been fascinating.
Definitely at the time, because without gravity, if you have a wound, there's no force to put the two surfaces together. So people had to wait till they got back to Earth before the wounds would heal, except they noticed in the space station when they're making hydroponic plants with light, all of the wounds healed. And that was the aha moment that led to the use of it. And it's all sprayed in all of the space shuttles and ships to help to counteract that effect of no gravity.
And are you saying that part of what makes this photobiomodulation, which is PBM for short, so when we reference PBM, that's what we're referring to, are you saying there's an aspect of it that is kind of similar to the process of photosynthesis that occurs in plants that is also healing to the human body?
Can I take that? It's the mechanism of action is actually quite similar. So we have in our mitochondria, which produces our energy, we have an electron transport chain, and that's very similar to the electron transport chain in plants. So we use the light gets absorbed in that electron transport chain, produces energy in a not dissimilar way to plants.
Mm-hmm. And fascinating. And obviously, we will be talking more about that. I also do want to introduce our third guest, who is Scott Faulkner, who has been on the episode before, and fascinating individual. You have been a leader in our House of Representatives, keeping that running for our nation. You have served in the Reagan White House, and currently you are treasurer of the PBM Foundation at Shepherd University, which is where everything kind of starts to tie together between the three of you. Can you tell us a little bit about that organization?
The PBM Foundation is basically, it pulls together, it helps, number one, helps facilitate collaborative research among various scientists and practitioners and institutions around the world. We actually are supporting, as an organization, of something called the World Association of Laser Therapy, which actually comprises over 500 scientists in 30 countries. So what we do is we help with finding resources, we help with collaborative research, and then as that research moves toward publication, we then make sure that research is known by influencers, but more importantly by policy decision makers, not only in the United States, but in other countries around the world, because our main goal is to make photobiomodulation a mainstream medical therapy, so that every hospital, every urgent care, every emergency room, every old age and senior center, basically people can have access to this amazing device that delivers this amazing light therapy to rebuild cellular function. And that's really our goal, is to move that ball forward. So the PBM Foundation, 501c3, again, our Center of Excellence is here at Shepherd University. But we have a global reach. Anne and Brian are from Australia. Other members of our board are from France and England, Canada, and other places around the world.
Very interesting. And I guess when it comes to PBM, is it really as simple as saying that it is a laser beam? I mean, something that's also been called, I believe, is red light therapy. So that's a term some people may have actually heard. What is the process by which this light has these amazing results in all of these areas?
So photobiomodulation includes laser beams and LED light, and the difference is whether it is coherent and all of the photons, which is the unit of light, are lined up in unison. So when they are coherent, the light has a larger ability to be able to go through surfaces like skin and skull, and in different wavelengths have different depths of penetration, and some of the infrared wavelengths that we use go in about 2 to 3 centimeters. The wavelengths of red light laser also penetrate, and the LED light works on the surface. So if you've got superficial wounds or non-healing ulcers or other problems on the surface, you can use LED. Plus, the skull and the brain are very absorbent of light, so you can use LED light helmets to actually have an impact on the whole of the brain waves. For example, at our university, they did study of brain waves with just putting one of our helmets that we'll be talking about later in the research across the world on people that had no problems. And when they were just thinking, it didn't change the brain waves. But as soon as they started to do finger tapping, their finger tapping improved. And it changed the brain waves, changed the energy, and changed the ability of the person to perform a task. And we utilize that not for normal to become super normal, but for in terms of injury and recovery as well.
And how long did it take to see those improvements? Was this something done after 5 treatments, or are we talking right away in the middle of the treatment?
You would see a response if it is a musculoskeletal problem that has pain straight away. It has an immediate response, and we can map that on our nerves if we have an MRI. But then we have a molecular response after 24 hours. And cumulatively, after the 3 or 5 treatments, you have a cumulative response as well. And you're switching the body's own mechanism and immune response as well. So in an area of an acute injury that's going to be recovered, you'll help it to recover more quickly and resolve the issue, and the person will not need ongoing treatment. If it's a chronic injury that's been there for a long time with a lot of changes to the body's metabolism, you may have to keep ongoing treatment, and that's where home light systems are important.
And Brian, one of the other aspects that is kind of a partner to the red light therapy, for lack of a better term, is what's called the gut microbiome. And that is something that you are particularly an expert in and kind of bring to the research here. Can you explain to us what the gut microbiome is, and how is this affecting and benefiting this PBM?
How long do you have?
The cliff notes, I guess, as
well,
best.
I'm going to edit you down to 2-minute response. So you tell me.
Okay, the gut microbiome is all of the bacteria and other microorganisms that live in mostly our large intestine, and there's a direct link from the intestine back to the brain. It's called the gut-brain axis, and it's a two-way communication. So if something affects your brain, it'll affect your gut microbiome. If something affects your gut microbiome, it'll affect your brain. If that group of bacteria is in balance and everything's happy, then that produces a lot of good metabolites from the bacteria that help the brain. They keep the brain happy. So it produces a lot of serotonin, produces dopamine, and yeah, everything is in balance, everything is happy. As things change, if you become overweight, if you get diabetes, as you age, actually, your microbiome changes. You produce less of these good metabolites. And what happens is you start to get leaky gut. So you get microbes and other metabolites moving through the gut into the tissues, and that sets up inflammation. And many of our aging problems and metabolic problems are inflammation. So what we try to do is improve the gut microbiome with light therapy and reduce that inflammation and balance that gut-brain axis. So the bad inflammation affects Parkinson's disease, Alzheimer's disease, all of those neurodegenerative diseases. If we can improve the gut microbiome, we get improved signaling to the brain. And so that's another way of affecting the brain. We can affect the gut and therefore affect the brain. So as well as directly shining light on the brain, we can shine light on the abdomen, change the microbiome, change the signaling, and therefore affect the brain.
And
So Brian, answer me this question. Why does my gut microbiome always indicate that I should go to McDonald's? Why is that? Why is it communicating that?
Yes, there is a gut-brain axis where your gut is telling your brain what to do. I would suggest that maybe your gut microbiome is not quite in balance. If it was more in balance, then maybe it would be saying, go and find some broccoli.
It's never done that, Brian. Never. It has never communicated that to me in 63 years. I could be a first time, though. You never know.
I would have to second that. Even when I was young, my gut microbiome was not telling me that. But that is something that I have heard more about, and particularly when you mentioned the serotonin, those sorts of chemicals. Are we also referring to, or is this leading to how your PBM treatments? Is there a use for mental health issues as well?
We certainly believe so. We've mostly focused on Parkinson's, but a side benefit of the Parkinson's treatment is that their quality of life improves. They're happier, they're healthier, they're less depressed. Now, whether that's a knock-on effect or whether that's a direct effect, we don't actually know. But in the end, everything is related, right? So if you can improve one aspect and that improves your brain in some way, then that's a good thing.
And will that lead to addictions as well?
For light addiction?
No, addiction to drugs or alcohol.
Well, in terms of drugs and alcohol, there's been some studies actually at Shepherd University showing that light therapy can help wean people off their opioid addiction. It helps with the recovery. It helps with the continued healthiness after the addiction process finishes. So I think our reliance on medication is too strong in the Western world, and I think the light therapy really gets you back to basics. I mean, everyone knows that sunshine is good for you, right? The morning sun makes you feel better, increases your serotonin. If we can replace at least some of these drugs that we use with light therapy, I think benefit, everybody wins.
Fascinating.
Maybe apart from the drug companies, I'm not sure about that actually.
Absolutely. And would to follow up with Mark's question, is there a overlap where you mentioned how it does actually affect positively opioid addictions? Has there been any research on other drugs such as heroin or any of these other drugs that are a plague upon our society?
Not that I'm aware of. The Shepherd study was fairly cutting edge and one of the first of its kind. There's been a couple of other much smaller studies in the past, but certainly that's an area that we'd like to get more into, and because we do have a huge problem with drug addiction and definitely opioid addiction, and in this part of the world, and America generally.
Mm-hmm. And Scott, obviously you, despite your many qualifications, I don't believe medical researcher is one of the qualifications you have under your belt.
Although it wouldn't surprise us if it did.
Now, how did you end up getting involved in this research and what is happening at Shepherd University and with Ann and Brian?
10 years ago, the Optical Society of America convened 75 researchers and practitioners in photobiomodulation from 12 different countries to say, we have this amazing global network of researchers. We are sharing that research through WALT, but none of this research seems to be reaching decision makers, either in America, European Commission, or other parts of the world. So how do we finally all come together, not only for the collaborative research and collaborative publication, but how do we collaborate on actually getting photobiomodulation into mainstream medicine through decision makers in the private sector and decision makers in the public sector? So I facilitated that strategic retreat, and at the end of it, they said, well, someone's going to actually put all this together, and they looked down the table at me. And so that's how I got involved. And as I always joke with my wife, I've learned more 5-syllable words in the last 10 years than I knew existed. But the key is that Shepherd University, not only because it's local, but also it's the first nursing school in America to actually require knowledge and application of photobiomodulation as part of their degree program. So between that and the amazing leadership of President Mary Hendricks, who was actually cancer researcher in her own right, Shepherd has become a major hub, even though it's a small university. But we have hubs at many other places around the world. We have an incredible network of people up at Boston, at both Massachusetts General Hospital and Harvard Medical, out at Brigham Young University and University of Utah, and a number of institutions and clinics up in the Toronto area. So just in North America alone, we have some amazing depth and of expertise in these different places. And so in terms of the Photobiomodulation Foundation moving policy forward, we've actually received major decisions from probably the best one relating to what we've been talking about is the Center for Disease Control 3 years ago updated their opioid prescription guidelines. And for the first time, and a number of us testified numerous times before their board of experts, they said that photobiomodulation is the preferred pain management approach for non-pharmaceutical alternatives. And so one of our frustrations is that it's never been publicized, but it is in the prescription guidelines. We've also had tremendous success bringing photobiomodulation into a number of veterans hospitals, not only for dealing with neurological conditions like PTSD and traumatic brain injury, and again, receiving recommendations from the VA on that, but in a number of other VAs dealing with pain management as part of their physical rehabilitation programs. We also have tremendous traction in the world of cancer, where if you pre-treat cancer patients before they go through either radiotherapy or chemotherapy, you actually prevent certain side effects that happen in the mouth and throat, where sores arise, and in the worst case scenario, it's called oral mucositis, where you literally can no longer swallow. So either you have to get a feeding tube, or you actually have to suspend cancer treatment. In either case, cancer advances. And so a number of major organizations, including the Multinational Association for Supportive Care in Cancer, have established photobiomodulation pre-treatment as a standard of care. And every major cancer center in America, University of Pittsburgh Medical Centers treated over 2,200 cancer patients. Are one of the most amazing ones is St. Jude, where it is so safe and so effective that all of their pediatric cancer patients are being treated with photobiomodulation before the chemotherapy. And one of our partner companies, we have about 30 companies that partner with the foundation, actually developed a popsicle-shaped probe that the children can suck on, so they're not being freaked out by a medical device. They basically say, suck on this, and the light from the popsicle brings PBM into the throat, into the mouth, and is highly effective. So we have some amazing success stories that we're trying to build on that.
Well, this is phenomenal. And obviously, that's why you have gotten awards for the research that you're doing. But one point that you bring up, Scott, that is vitally important, that many, many people have wondered about, is when it comes to treatments like this, and there's various other treatments, but where the record behind them is very strong. And as you mentioned, it just isn't getting picked up by decision makers and used the way that it should. Why is that? I mean, Brian mentioned a moment ago that the pharmaceutical companies probably would not be happy by some of these results as far as it affects their revenues. That's what most people kind of conclude, is that it's a battle with money-making entities in the industry. But in reality, to the best of your judgment, what is it that makes it so hard for these very promising things in many areas, but to reach the mainstream?
I think because established medicine, whether it's the medical schools, nursing schools, the clinics and institutions themselves, they are conservative, small c, where they basically are mired in the past. You know, for the last, I like to say the history of medicine is it began centuries ago where you cast out the demons, then you bled out the humors, and then it got into cutting it out and drugging it out. And we're talking about lighting it up. And that's a totally different approach. And it sounds too simple, but it is simple, because Brian and Ann said, we are like warm-blooded plants, and we need our vitamin Ds. We're happy in the sunlight, and at that molecular level, photosynthesis and PBM are very, very similar. So to tell people use a very specific part of the light spectrum, red and infrared light, basically around 500 to 1100 nanometers in specific parts of the body with a specific intensity, you can do wonderful things. It sounds like snake oil to a lot of people. There are skeptics out there that think that. But on the other hand, we have over 12,000 published studies, 2,200 randomized controlled clinical trials, 530 studies currently underway, registered with the National Institutes of Health. And so it's the mountain of evidence is there, but a lot of people, it just sounds too good to be true. And the institutions just are not ready to admit that maybe there's something other than what they're doing is superior.
Right. And in other words, it could be greed, but also what you're describing is human nature, sincere people just following human nature.
Exactly.
And one of the things that you have as a particular kind of a success story of the many, but there's one particular person who kind of, I guess, made things that much more obvious in general, is a patient that you treated for Parkinson's, essentially what is known as an untreatable disease. And you treated this patient. Can you explain to us what happened there?
I certainly can. And so I started a trial over 7 years ago in Adelaide. The Parkinson South Australia asked us to look at a trial to use photobiomodulation as an adjunctive therapy to other treatments, which are dopamine replacement therapy and other medications and exercise, as if we would be able to evaluate its use. And so we decided to go over there and start the trial. We had ethics, we had a neurologist that did all the assessments, so it was completely objective. And it was originally meant to start for 6 months. And interestingly, we were using a helmet device and a gut device that we talked about before. And we decided we would swap our clients over after 3 months and have them waiting and then have a crossover trial. And one of the clients, not this one that I'm going to show you, they decided to ask the neurologist, who was not very happy about it, but then he had not really slept very much for 3 years, apart from a couple of hours a night. And at 6 to 7 weeks, which I will show you what happened to this lovely participant, Margaret, he started sleeping through the night. So this neurologist rang me and said, you cannot stop this treatment because we don't know what's happened. But if you stop it and start it, it may not work. So can you please not stop it? So we changed from having a crossover design to a waitlist design. So some people waited for the treatment and some people started straight away. And we evaluated them at 6 months and then at 1 year. And because of the results, then at 2 years, then at 3 years, then at 5 years, and we've just finished the 7-year assessment. And okay, so Margaret,
Can I just sorry? Can I close the blind?
Yeah.
I'm blinded by the sun.
Actually, Brian, it looked like you were beaming up to the Starship Enterprise.
Thank
The light on your face like that. I was like, is he leaving us?
He's enlightened.
Is Scotty beaming him aboard? 'Cause-
so our first person could sleep, so we've changed now our trial. And this particular participant had stage 3 Yarra and Hall Parkinson, so she was quite advanced. She was very asymmetrical in her gait. She wasn't able to walk very far. She had no expression in her face. She had very severe symptoms of IBS and diarrhea. She didn't know if she could come to the church initially to conduct the trial. Was able to start the first trial with just our first transcranial treatment. And then she left for 3 hours and came back and said, would you mind reassessing me? I feel better. So we have that video to show that 3 hours later, you say, how long does it take? She was now walking much, much better. She continued the treatment, as I said, for 7 years. And after 7 weeks, all of her incredibly severe IBS symptoms stopped and have been in remission since. She hadn't smelt anything for 7 years. And so that's one of the first symptoms of Parkinson's. So after about 7 weeks, she started to get her sense of smell back. By a year, it was fully perfect and has continued to be sustained. And her gait has continued to improve over 7 years. So normally in a Parkinson's patient, you would expect them to get a little bit worse every year and have to increase their medication every year. She has not increased her medication from day one. She has not got any worse. She improved and has stayed improved for that whole 7 years. And she has an amazing quality of life that has been as a result, and she is continuing the home treatment 3 times a week. It's been a wonderful experience for her. She's a super responder. Not all people respond to all things. People partially respond, and there are some non-responders, but she has had an amazing change in her quality of life. And so at the 5-year reassessment, the neurologist who we flew down to Adelaide to do the assessment said, this results are so good in 7 out of 12 of our original participants, we have to extend it for 7 years. And then Brian has tracked the microbiome in that whole time and looked at the DNA of the microbiome that he can talk to. And interestingly, at that 7 weeks, when she starts to smell something and starts to improve her IBS, her microbiome improved, and he has tracked the microbiome for the whole time. It's continued to stay improved in terms of diversity.
Fascinating. And as you were talking, I couldn't help but think about the fact that my grandmother spent the last few months of her life bedridden as a result of Parkinson's. So that phenomenal work. And Brian, in regards to what Anne had just mentioned with the microbiome, another area of treatment that you guys have had success in your research is autism, which has a particularly strong relation to the microbiome, if I understand correctly. Can you go into a bit of detail? Because, of course, in America, autism is about 220% more prevalent in America than the rest of the world. Can you go into a bit of detail about what you have found out about autism?
Yeah, that's an incredible statistic. It would be really nice to know why. I'm sorry, beaming up again. It would be really nice to know, what the cause of that is. We tend to think that there's multiple causes, no one single cause, but the microbiome is incredibly important, and we've had some success with autism. The problem we have with autism is they're starting with a bad microbiome from a very young age. If you're shining light and you're improving the microbiome, you can't improve what's not there. So you can't, make bacteria from nothing. What you can do is get those good bacteria growing up and becoming more dominant and improving the health of the whole system. So what we find with the autism is we need to do fecal microbiome transplants as well. So we've had the most success with young kids, sort of averbal kids. We've brought them a lot of relief. We've started them talking again. We've got a couple of examples of very good results, but it's always the best result is combined with fecal microbiome transplant. So if you have a good donor who has a good mix of bacteria and you can replace the autism microbiome with a good microbiome and then use the lasers and the LEDs, we get some good results. That's, as I said, that's not our main area of study. We've done a bit of autism. We've done a little bit of Alzheimer's. We're mostly focusing on Parkinson's. But we are getting good results with autism.
And can I add one thing to that? There's a condition called PANDA, which is when you become very sick with an infection, and you develop, when you've had no symptoms of autism as a child, all the spectrum of autism conditions. Now, if you treat the original infection and then utilize the PBM where you've had a previous good microbiome, that's been a very good effect. And now they're saying this acquired autism from the bacteria can also affect adults, and that was very surprising to me. And in the last Los Angeles Olympics, when there was a large infection through the Olympic Village, there were some adults that acquired this condition. That is reversible because it's been induced by an infection. But we know that antibiotics can have an effect on the microbiome, and it is postulated and being certainly looked at as the effect of antibiotics usage on prevalence of autism. And certainly your 20-year history of taking broad-spectrum antibiotics is not a causative, but it is a slight risk factor for Parkinson's. And so these are things that we'd be able to address, but be able to address very practically the gut when it has become dysbiotic has been an incredible experience for us. And I didn't know it until Brian said, if you're treating the gut and they're getting better, maybe you're treating the microbiome. And we did all of this work in Sydney University in the lab and looked at the microbiome and the effects of different wavelengths on the effect on Parkinson's. And he was right.
Fascinating. And Brian, when you mention the fecal transplants, just to clarify, and not to gross anyone out, but it's a very important point, is what you're referring to is taking the literal fecal matter from people with healthy microbiomes, and putting them in individuals whom you know have unhealthy microbiomes. Is that an accurate description?
That's exactly it. So what you need most of all is to find a young, healthy, fit person with a good microbiome.
Who's full of poop.
Well, mostly we are full of poop, but it's really important to have a good donor. That's the most important thing. There's been some very bad examples of bad effects of when the donors are not screened properly.
So Brian, when the fecal matter is transplanted, what does it actually do to the body to create a healthier condition for the patient?
What you usually do is try and clean out the body of its own microbiome. So, like if you're going for a colonoscopy and you clean out the gut, it's the same sort of process, and then you re-establish the microbiome with this new microbiome from a donor, and that can be through a suppository. Don't want to gross anybody out too much, but the other way that they do it is by eating. They call them crapsules.
Yeah, I don't know that I'd go with the crapsicle. I don't know that's going to be something high on my list.
And I mean, it's actually quite difficult with ASD patients because they're kind of sensitive to all sorts of things, and so to get them to do this fecal microbiome transplant is not a trivial thing.
Is using and taking probiotics, is that the equivalent of what you're referring to and making the microbiome a healthier place?
No. With the probiotics, you still have your own microbiome, and so what you're trying to do is improve it. Probiotics may work in some cases. When I look at microbiome signatures, I don't usually see the probiotics there. I don't see them established in the microbiome, but maybe they're producing conditions to help the microbiome get back to a good diversity. I think more important is prebiotics, which is when you're eating things like fibers that are going to feed the bacteria that are there. So you're encouraging the good bacteria that are already there to increase in numbers. So I think prebiotics are very important, but I think we're quite surprised at how much difference we made when we used light to improve the microbiome.
Absolutely. And Scott, all of these amazing results that are being discussed and have been occurring now for 30 years. Something also that I neglected to mention earlier is that Anne and Brian are also now the most cited researchers in the world when it comes to other medical professionals discussing PBM and all these different effects that we're talking about. But of course, none of it really has that much practical use if it can't be delivered to the masses. And that is something where you come into play very strongly. You had mentioned companies, et cetera. So what other steps are being taken to educate the public, and how can people get more information about this?
Well, first of all, let's take the last part. If you go to www.pbmfoundation.org, we have designed a website that is really a one-stop shop. Not only is there a section called Basics, where we have a lot of wonderful articles, slide decks, and videos explaining to a lay audience what this really is, how it works, and various applications. And then we have another section which we call Areas of Study, which is divided currently into 14 different parts, where we have the latest published peer-reviewed research on how PBM is successfully addressing a number of medical conditions. Probably one of the ones that also affects an aging population is age-related macular degeneration. If you have parents or yourself, you can, and you have the wet form, you can get injections. That's been around for a long time. But if you have the dry form, there has been no effective way to reverse what ultimately becomes blindness until Dr. Clark Tedford and Lumathera out of Seattle a number of years ago, working very closely for a number of years with the Food and Drug Administration, now have a formal indication for use that if you use photobiomodulation on the eyes, you can not only stop the forward progress of dry macular degeneration, you can reverse it. And that is a huge hope for literally millions of people who literally, if you're in your 70s or 80s and you go blind, you're not going to learn Braille. Basically, your life is over. And so this is an amazing breakthrough and of hope and actually real tangible results. And so that's a huge area and a huge victory for us. In terms of the overall issue, podcasts like this, other media that we do is to try to broaden it to the general population. And also we look for partners. I mean, one of the most exciting new partnerships is with NASCAR. NASCAR drivers obviously sustain head injuries from accidents, but more importantly, as they're going around those curves at 180, 190, even 200 miles an hour, they're getting G-forces, and those G-forces are affecting their neurological conditions. So several months ago, NASCAR reached out to the Photobiomodulation Foundation, and on June 12th at Pocono, we are premiering a PBM car driven by Sheldon Creed, who's the number 2 point score driver in the NASCAR Cup circuit right now. So we're going to have, and they've already pledged literally millions of dollars of promotion of how to provide driver safety initially in NASCAR, but ultimately to the Formula One circuit as well. So we always are looking for partners like that who are basically giving us not only frontline practical opportunities to improve people's safety and health, but to actually blow the trumpets and say this is real. So that the NASCAR partnership is very, very exciting.
That fantastic. And Sheldon Creed, by the way, is he's the number 4 points leader in NASCAR this year, and he is carrying your logo for the products that are delivering this to everyone. And
exactly.
On top of that, there is also for local individuals, Shepherd University, with what they are doing. Is that available to the public? Can the public come and drive to Shepherd and get treatment there that way as well?
Absolutely. Dr. Jenny Flora, who's the Dean for Athletics and Health at Shepherd University, the Wellness Center is probably one of the most beautiful and well-developed wellness centers, I would say, in America. It's a gorgeous facility. It's open to the public, and they have been offering photobiomodulation services for a number of years. So there's actually 2 there's a number of ways to deliver photobiomodulation. We've talked about helmets, we've talked about handhelds. They have beds. Novathor is probably the best light bed out there. And so they have two very large beds designed mostly for their athletics people. But you basically climb in that bed for anywhere from 12 to 20 minutes, and you're going to get better sleep. You're going to have a lot of aches and pains go away. If you open your eyes a few times during the treatment, your floaters are going to go away, and eyesight actually starts to improve a bit. And so, plus they have Kerber devices, which are the handhelds, and they have V-Light devices, which are some of the helmet types, and they actually will rent them out or lease them out to people to help with different conditions. So they will assess people. Also, again, with the beds, because it is a wellness center with a jogging track and weight room and everything else. One of the things about PBM is that if people are trying to be healthier and they over-exercise and they start feeling aches and pains, they may not exercise as much. If you start to pre-treat before doing strenuous exercise and you don't get those aches and pains, guess what? You're going to go and exercise more often. So it's a wonderful, positive wellness cycle that PBM is now integral to. And Shepherd University is not only is it the global center of excellence for the PBM Foundation, but it is literally the regional center for PBM applications for normal people.
So if our Parkinson's research, we have now such excellent trials. We would like to do a very, very large trial, multi-center here in America and in Australia to absolutely show beyond doubt how the percentage of people that it can help and moving forward in terms of ASD in the medical profession, which we work with. We're going to be doing a lot of liaison with all of the specialist doctors. So in terms of autism spectrum, we work very, very closely with the medical profession as well to work out first the origins and then the treatment that's the most effective. And for all the other impending neurological conditions that are going to be increasing with aging, with inflammation, we hope to be able to help in many of those things going forward in the future and have quality of health span rather than lifespan and less chronic disease and less burden of health on our society.
And one other thing that we are doing is we're starting a trial for kidney disease, diabetic kidney disease, which is another disease that has really no treatment. And we've done that in the lab. We've shown it in mice. And we're moving to a human trial now. So we're very hopeful about that as well.
The veterinary profession was one of the earliest professions to embrace photobiomodulation. So most major veterinary clinics and practices around the United States, if you bring in your cat for hip dysplasia and renal failure or arthritis, if you're bringing your dog for hip dysplasia, arthritis, they will be treated effectively. If you have a horse, equine PBM applications have been around for many, many years, especially in the dressage community. So the irony is, in America, your dog and cat and horse have more access to PBM treatments than you. And so what we're hoping is that people, when they go and have any number of conditions that we've talked about, and there are many others, again, that are listed on our website, ask their doctor, why can't I use PBM for this? And if the doctor says, well, I've never heard of it, give them the website. If they have heard of it, say, well, how do we have this as part? Again, we're not saying suspend traditional treatment protocols. We're saying as an adjunct, PBM has over 100 million patients over the last 30 years in clinical settings have been treated without one single documented side effect. So it is never going to hurt. It's going to help. And so standard of care plus photobiomodulation is certainly the way to go, and that's what we've been promoting in every place available.
Well, again, thank you for joining us, and I want to wish you all the best of luck, both for yourselves, but also for the rest of us. So thank you for joining us this evening.
You folks are definitely doing God's work. It's going to be a blessing to our society. Thank you so much for being with us tonight on Mid-Maryland Votes.
So
Pleasure. Thank you.
Pleasure. Thank you.
That's been this episode of Mid-Maryland Votes. I'm your host, Mark Flynn. With me is my co-host,
Ethan Lowen.
We want to thank our distinguished guests, Ann, Brian, and Scott. Thank you for coming out, and we'll see you next time on Mid-Maryland Votes. Photobiomodulation becomes a medical revolution or simply just another tool in the toolbox. The research is fascinating, and the possibilities are enormous. From Parkinson's disease and brain injuries to healing in zero gravity, today's conversation explored a technology that may change the way we think about medicine. Thanks for joining us, and we'll see you next time on Mid-Maryland Votes.